My name is Jen. I am the certified orthotic fitter here at the Arthritis and Knee Pain Center in Wall Township, New Jersey. Today we're going to be talking about unloader braces, these right here. The purpose of an unloader brace is to do exactly what it sounds like, unload pressure off of the knee in the affected area. Our knee braces are prescribed along with the use of our gel injections because they work synergistically together. The brace helps the alignment and mechanics of the knee, where the gel lubricates the joint and makes it move a little bit easier. What the knee brace does is it redistributes the load from one compartment of the knee to the other. It takes about 80 pounds of pressure off of your knee simply by changing the biomechanics of your leg. When you put it on, it sits on the outside of your leg, like so, and I adjust it depending on where the arthritis is. So if the arthritis is on the outside of the knee, we adjust it to pull. If the arthritis is on the inside of the knee, we adjust it to push. Pushing on the knee at the center causes the top here to pull and the bottom here to pull, therefore opening the joint space on the inside. A lot of people feel like bracing can be confining, but it only needs to be worn about 3 to 5 hours a day to get benefit out of it. The times you're going to want to wear the brace are when you're up and moving around. When you're just sitting or resting, laying in your bed, you're not putting any weight on the brace or your knee, so therefore it's not really doing anything for you. You want to wear it when you're up and moving around. The difference between our braces here and something that you would order online are that ours are made to fit for each patient that walks into the building. I make sure that they fit you, you're comfortable, and that the adjustment is specific to your arthritis. People who wear braces while they're getting their gel injections tend to just get an overall better result. We also teach you how to use the braces, and we make sure that you have a full understanding of how to get them on and take them off before you leave. I'm going to invite my colleague Doug in so I can show you what this brace would look like in real time. All right, Doug, you ready?
I am.
When the brace comes out of the bag, it comes out in a neutral position, right? So you're either gonna have medial arthritis, that's on the inside of the knee, or lateral arthritis, it's on the outside. Yours is more on the outside. So when we put the brace on, we line it up with your anatomy, and we put the straps on, starting here right below the knee. This is the anchor strap. This is the most important one. It holds the brace up in place for you. Okay, then we move down to the bottom. Cool feature, these are also numbered if you forget. People often do. All right, and then we move to the top. So the straps on some of these are really, really, really long. This is what I mean by fit for you. So we take all these straps, make them fit nice and snug. All right, so they don't have to be too tight, they don't have to be too loose. You want them just snug enough to do their job, but still be comfortable. So, if your arthritis was on the inside, we would be adjusting this one way to push, but it's not, it's on the outside. So what we're going to do is put a clockwise turn in here, just a little bit, 1/8 of a turn will give you relief. Now that's pulling on your knee here, pushing here, and relieving that pressure from the outside of the knee.
Wow.
To demonstrate how this works, I'm going to fit one of our patients, pro football legend Phil Simms.
Jennifer?
Yes,
Okay,
Jennifer.
good. Nice
Nice
to see you.
to meet
Phil.
you.
Nice to see you. Yes. You want me to sit here?
Yeah, see.
Okay.
Yes, so then when we put it on, you already had it. So this,
Right here?
a little lower, but
Lower?
up, that's fine. And then you want to be a little bit more towards the posterior of the leg.
Oh, okay. Maybe
Okay.
that's part of my
It
problem.
could have been a little bit of everything, so
Yeah.
that's fine. And it's this strap here that we're going to put on first. So this one right below the knee, she's
Alright.
going to go first.
Right.
This is the anchor strap. So this strap holds the brace up on to your calf.
Okay.
Okay. And then
The top one? You want this that way?
Yep, so I always tell people knee down and knee up.
Okay. Good way to remember. It's not that tight.
Right. Because we loosened it so you would have play in the straps. So then
Oh,
you
you-
can go through
You want, oh, okay.
and just make it snug to your comfort.
Can I pull it too tight? Is that possible?
You won't be comfortable. So just,
Oh, okay.
yeah. If you're not comfortable, loosen it. If you're comfortable, then you're good. Yeah.
Okay.
Want to do it again? Yeah,
Can I
walk
stand-
around.
can I stand
Sure,
up?
absolutely.
To see how much it moves. Yeah.
So this strap helps
Oh,
hold the
my
brace up in place, just with some extra tension. The
Okay.
important thing about it is when you put it on, is you want it to pull away from from the right? If
Okay.
we pull this way, we're going to
Okay.
pull the brace around up on, and it's not going to do its job.
Point.
So
Oh.
it just velcros right to itself, and then just as much tension as you want. But you know, the more tension, the more it's going to help pull it up.
Oh, okay. So you didn't put it. Okay, that's interesting.
Yeah, it feels pretty good.
Yeah,
I'm
so
gonna
as
try it
you
out today.
move, it's
Oh,
gonna
that's much
fall
better.
around- you know, it's going to fall into place. So as you move down your thigh,
Yeah,
the circumference gets smaller. So
but that was
you
better.
may-
Once we
yeah.
tighten it, I can tell a whole difference now.
Good.
Now I feel like no matter what I do, it's gonna stay there. Let me see. I'm gonna turn and hit that. How'd that look?
It looks great.
No, I mean my golf swing.
That's what I was looking at. To learn more about our unloader knee braces, visit our website or call us to schedule a no-charge screening.